New at 10, with COVID cases on the rise, emergency rooms throughout the state are already feeling the added stress, but not in the form of hospitalizations.
WAAY 31's Nicole Zedek learned more about how the emergency department at the University of Alabama at Birmingham is dealing with an increase in minor COVID cases. Nicole.
Well, according to UAB, emergency room visits have really increased over the past 10 days. Now, they're having to deal with more than 200 patients in their usual busy day, as people with minor COVID symptoms are going to the emergency room for treatment.
All of these emergency departments, not just ours, but everyone around the city, is experiencing record numbers of patients presenting with COVID and all the other complaints that we see on a day-to-day basis.
An overflowing emergency room at the University of Alabama at Birmingham, as doctors tackle regular ER visits alongside the increase in COVID-19 patients.
All three of our EDs on a busy day would see about 450 patients in the past, and yesterday it was 617 total.
Dr. Bobby Lewis says one of the main problems is people going to the ER with minor COVID symptoms, or even for a COVID test.
We can't really do anything for all those very minor symptoms that you have, such as a stuffy nose or a sore throat.
He's urging patients with mild symptoms to go to their local doctor or clinic, rather than heading straight to the emergency room.
We want to see all the correct patients. We will take care of everybody, and we'd like everybody to get the proper care that they need at the proper location.
Going to the proper location to hopefully ease the burden on our healthcare system.
Understand, this is a big burden on all healthcare workers.
Dr. Lewis says for people experiencing a high fever or shortness of breath, those are reasons to go to the emergency room. But for those who just need a COVID test or have a stuffy nose, go to the local clinic and leave the emergency rooms for actual emergencies. Reporting live in studio, Nicole Zedek, WAAY 31 News.
Thanks, Nicole. For anyone who needs to go to the emergency room for a non-COVID related event, UAB says they're doing everything they can to maintain a safe environment and separate patients who have COVID from those who don't.